In this next chapter, chapter 6, we'll be going over the human body and the basics of anatomy and physiology. The National EMS Education Standard Competencies for Anatomy and Physiology and Lifespan Development use the simple knowledge of the anatomy and function of the upper airway, heart, vessels, blood, lungs, skin, muscles, bones as the foundation of emergency care. For lifespan development, it uses a simple knowledge of age-related differences to assess and care for patients. So you must understand the basic structure and functions of the human body. This knowledge will help you with better understand the specific location of symptoms a patient is experiencing, perform an adequate patient examination, communicate with your findings to others and other EMS providers and higher level care providers, and then provide appropriate emergency treatment. Let's go over topographic anatomy. Here on your screen you'll see a diagram of the human body standing in the standard anatomical position. A person is facing you with their arms at their sides and their thumbs pointed outwards with the palms of their hands towards you as well. The anterior is the front surface of the body. The posterior is the back. Midline refers to an imaginary vertical line drawn from the head to the toe that separates the body into left and right. Medial is the closer to midline. So if this is my midline, this is my lateral. Medial is going to be closer to the inside. Lateral is away from the middle, so the outside of my arm would be the lateral side of my arm. The medial side would be the inside of my arm. Proximal means close. Distal means farther away or distance. Superior is closer to the head, and inferior is closer to the feet. The respiratory system consists of all structures of the body that contribute to normal breathing. It brings oxygen into the body and removes the waste gas, carbon monoxide, and exhales it out of the body. Your airway consists of your nose, your mouth, throat, larynx, trachea, and airway passages within the lungs. At the upper end of the larynx is a tiny flap of tissue called the epiglottis, which keeps the food from entering the larynx. And you can see here with my pointer on the screen, I'm pointing at the epiglottis there. The larger air passages of the lungs, the bronchi. You have your left bronchial and your right bronchial. Branch into many lower passages called bronchioles, and then they branch even further down into your alveolar. The airway ends in tiny air sacs, which are called the alveoli. Oxygen is inhaled, air passes through the thin walls that separate the air sacs from the blood vessels, and it is absorbed by the blood. You can see here a representation of that process in the diagram in the middle of your screen. Carbon dioxide passes through the blood and across the thin walls into air sacs and is exhaled. The rate of breathing increases when the body needs more oxygen and when it generates additional carbon monoxide. So when we're running or doing some heavy or strenuous work outside, our respiratory rate increases because of the higher oxygen demand and the higher carbon dioxide off-gassing or production. Air is inhaled when the diaphragm moves downward and the chest muscles contract to expand the chest size. Air is exhaled when the chest muscles relax and decrease the size of the chest. So if you can take a couple deep breaths, and when you breathe in, you can actually feel your rib cage expanding and your diaphragm actually dropping. And if you'll notice, you're actually using muscles to inhale, and then when you relax, your rib cage naturally falls down and contracts or reduces in size. So moving on to the circulatory system, it includes the heart, blood vessels and the blood within those vessels. The blood flow of the heart, blood picks up oxygen in the lungs and goes to the heart. The heart pumps it to the rest of the body, and then cells absorb the oxygen and the nutrients that the blood brings to them, and they release the waste products back into the blood, which in turn the blood travels to or carries that to the kidneys and the lungs for exchange or expulsion from the body. In the lungs, blood exchanges carbon dioxide for more oxygen. The heart consists of 4 chambers. You have your 2 upper chambers, which are your atrium, and your 2 lower chambers, which are your ventricles. The chambers work together to pump blood to the lungs and to the rest of the body and circulate that throughout. There are one-way check valves that allow blood to flow in only one direction. If you look at your schematic here of the heart, you'll see here where my pointer is that blood enters the heart through the superior vena cava, which is the low pressurized or your vein, into the right atrium. Goes through your first one-way check valve here, which is your tricuspid valve, into the right ventricle. From there, the right ventricle pushes the heart or the blood through the pulmonary valves or into the pulmonary artery into the lungs, and this is where that gas exchange happens. Your cells absorb the oxygen, and they also deplete the carbon dioxide, which you exhale for that gas exchange. Once your blood is oxygenated, it returns through the pulmonary veins and pulmonary valve, or your second pulmonary valve, into the left atrium of the heart. From there is your fourth one-way check valve, which is actually the bicuspid valve that separates your left atrium from your left ventricle. Once the blood enters the left ventricle, it is then pumped out of the heart through the aorta and off to the various parts of your body for gas exchange there at the cellular level. Arteries carry blood away from the heart at high pressure. This is why it's so important for us as emergency providers when we are confronted with arterial bleed or massive hemorrhage in the field, that we rapidly get a pressure dressing or a tourniquet on that injury or above that injury to stop that hemorrhage, that due to that high pressure expelling blood from the body. There are 3 major arteries that we look at in emergency medicine. We have the neck or the carotid artery, your groin or femoral artery, and then the wrist or your radial artery. Radial we usually check on conscious and responsive patients, ones that we don't have a high index of suspicion for acute injury or illness. And then, of course, on unresponsive or in the event of cardiac arrests, we typically check for carotid pulses or femoral pulses in the groin. This being that the radial artery is the first to lose that pulse pressure in the event of hypotensive crises. Capillaries, these are the smallest vessels in our body, usually in our fingertips or just underneath our skin. Veins are thin-walled vessels that carry blood back to the heart. And then blood has several components. We have plasma, red blood cells, white blood cells, and platelets. Here in this diagram on the right-hand side of your slide, you can see where the location for your carotid pulse or your carotid artery. Your femoral artery is just kind of on the medial side of the groin on both legs. And then your radial artery, this one is on the left wrist, but there's also one on the right wrist as well. The skeletal system consists of bones and connective tissues that protect as a protective framework that support the body. It has 3 major functions: to support your body and keep it in the anatomical position, protect vital structures such as your organs, and manufacture of red blood cells. And then here on the right-hand side of the screen, we have a picture of the human skeleton with all the main bones. And then we have the skull. Bones of the head include the skull, the lower jawbone, and consists of many bones fused together to form a hollow sphere that contains and protects the brain. The jawbone is a movable bone that is attached to the skull and completes the structure of the head. Moving on down the spine, it consists of 33 different vertebrae. spinal vertebrae are stacked on top of one another, and are held together by muscles, tendons, discs, and ligaments. The spinal cord passes through a hole in the center of each spinal vertebrae. The spine has 5 sections: the cervical spine, the thoracic spine, which I'll point at here, cervical spine, which consists of 7 vertebrae, the thoracic spine, which consists of 12, lumbar consists of 5, and then you have the sacral, which is also 5, and then the coccygeal vertebrae, which is 4. Those are typically fused together as well. Easy way for me to remember that is you eat breakfast at 7 o'clock in the morning, you have lunch at noon, which is 12 o'clock, and then you have dinner or supper at 5, and then there's just 5 left over. And then we have shoulder girdles. Each shoulder girdle supports an arm and consists of 3 bones. The collar bone, which is the clavicle, the shoulder blade, which is your scapula, and then the upper arm bone, which is the humerus. The upper extremity consists of 3 major bones as well. The upper arm has 1 bone called the humerus. The forearm has 2 bones called the ulna and the radius, which is also where we get our radial pulse from, that name. The wrist and the hand consist of several bones. The radius is actually located on the thumb or the lateral side of the arm, so if you hold it in your anatomical position, I don't know if you can see that, the radius is on the outside and the thumb is on the same side as the radius. And then the ulna is located on the side with your pinky, or on the medial side when you're standing in the anatomical position. And then we have our rib cage, the 12 sets of ribs that protect the heart, lungs, liver, and spleen. The sternum is located in the front of the chest, and the xiphoid process is a pointed structure found at the bottom of the sternum. If you feel your own rib cage where their lower ribs come together, you should be able to feel a little pointy prominence down there. Sometimes you have to push a little hard to actually feel that. But here on this picture, right there, you have the xiphoid process. The pelvis serves as a link between the body and the lower extremities. It protects your reproductive organs and other organs located in the lower abdominal cavity. Your lower extremities, each extremity consists of a thigh and leg. The thigh bone, better known as the femur, is the longest and strongest bone in the body, which always increases our index of suspicion to the mechanism of injury when we find a broken femur, and we have to take into consideration what was the mechanism or what was the force that actually caused that strongest bone in the body to break, and what other injuries might be being masked because of that. The leg has 2 bones called the tibia and the fibula. The kneecap, which is known as the patella, is a small flat bone that protects the knee joint. The ankle and foot contain a large number of smaller bones as well. We'll talk a little bit about some joints. Joints are where 2 bones come in contact with each other and a joint is formed, much like a hinge. They are held together by supporting tissues called tendons and ligaments, and they are lubricated by a thin fluid that is contained in a sac surrounding the joint, called synovial fluid. There are 3 types of joints in the human body. You've got fused joints, hinge joints, and ball and socket. Here on your screen, you've got a ball and socket here on the top where the arrow is pointing, and then you have a hinge joint. Fused joints do not permit any movement between the bone ends, kind of like in the joints in your skull. Hinge joints allow movement on one plane, something like your elbow, your fingers, or even your knees. And then your ball and socket joints, like your hip and your shoulders, allow movement in more than one plane in multiple directions. If movement occurs beyond the limits of a movable joint, injury or damage to the joint will occur. Your skeletal muscles provide support and movement by alternately contracting and relaxing. Your smooth muscles carry out automatic functions. This is also called involuntary muscles. And then your cardiac muscle is found only in the heart. The nervous system governs the body's functions. The nervous system consists of the brain, the spinal cord, and the individual nerves that extend all the way through your body down to your fingertips and your toes, things like that. The brain and the spinal cord are called the central nervous system. Cables of nerve fibers called the peripheral nervous system. The brain is the body's central computer, and it controls the functions of thinking, voluntary actions, and involuntary actions. And the spinal cord is a long tube-like structure that extends from the base of the brain, and nerves branch out from the spinal cord to each part of the body. And looking at your digestive system, it breaks down food into the form that can be carried by the circulatory system to the cells of the body. Food that is not used is eliminated as solid waste. Major organs of the digestive system are located in the abdomen. The digestive tract begins at the mouth and continues through the throat, esophagus, stomach, small intestines, and the large intestines, rectum, and then the anus. The digestive system also includes the liver. It produces bile to help digest fats. The gallbladder, pancreas, and the pancreas produces insulin to aid in the body's use. The genitourinary system is responsible for the body's reproductive functions and for removal of waste products. The male major reproductive organs are the testes, they produce sperm, and the penis, which delivers the sperm. And the major female reproductive organs are the ovaries, which produce the eggs, and the uterus, which holds the fertilized egg during pregnancy. The egg released by the ovaries travels to the uterus through the fallopian tubes. The external opening of the female reproductive system is called the birth canal or the vagina. Removal of waste products begins in the kidneys, which filter blood to form urine, and the urine flows down from the kidneys through tubes called ureters into the bladder, and the bladder collects and stores the urine before it passes out of the body through the urethra. Your skin covers all parts of your body and is also the largest organ of the body. It has three major functions. It protects the body from harmful substances in the environment. It regulates your body temperature, and it transmits information from the outside environment to the brain. The dermis is a deeper or inner layer of the skin, and the epidermis is the outer layer of the skin, which is located on top of the dermis. Skin is an effective barrier to bacteria and viruses as long as it is not broken by an injury. Skin can perceive touch, pressure, and pain, and it can sense degrees of hot and cold. Stages of life, growth, and development. Through a person's life, the body changes constantly. In an infant, the airway is very small and is easily obstructed or by swelling or objects. Because toddlers have poor coordination and balance, they are at a high risk for falls. School-aged children are physically active and more prone to injuries from bicycle riding or other athletic mishaps. Adolescents do not fully understand the consequences of dangerous actions. And early adulthood is the period when most of your body systems are fully developed. Middle adulthood is generally the time when the body systems start to decline. During late adulthood, the decline becomes more pronounced or more apparent, and you feel it at every waking hour. So your vital signs are most commonly measured your pulse or your heart rate, your respiration rate, and your blood pressure. Normal vital signs change with age. Normal pulse and respiration rates decrease while your systolic blood pressure increases. You have some other diagnostics considered to be vital signs. You have your blood glucose level and your pulse oximetry level, or your O2 saturation, oxygen saturation. Here is a chart, typical vital sign values based on age. So infants, your heart rate is typically 100 to 180, and that's newborn to 1 year of age. Respirations, 25 to 60 breaths per minute. and systolic pressure somewhere between 50 and 95. Children ages 1 through 12, their heart rate typically is 70 to about 150. Respirations slow down a little bit, 15 to 30. And then blood pressure, or your systolic blood pressure, 80 to about 110. And then adults, heart rate is typically for individuals considered to be healthy, 60 to 100. And then respirations, 12 to 20. And systolic pressure, blood pressure of 90 to 140. Here are some factors that can change certain vital signs: increased blood rate or pulse rate, respirations, and or systolic pressure, exercise, fever, illness, pain, stress, excess body weight, abuse of illegal drugs, and then decreased pulse rate, respirations, and or systolic blood pressure, athletic conditioning, blood pressure medications, or abuse of illegal drugs. Variations in normal vital sign values depend on three following factors: a person's size, a person's degree of physical condition, and medication that the person takes. Okay, in summary, the respiratory system consists of your lungs and your airway. Your circulatory system consists of the heart, which is your pump, the blood vessels, which are your pipes that carry your blood, and of course the blood itself, which fills the pipes and the heart. Your skeletal system provides support for your entire body and consists of your bones. Your muscular system consists of three different types of muscles or kinds of muscles: voluntary, which are your skeletal muscles; smooth muscles or involuntary muscles; and then your cardiac muscles, which is your heart. The nervous system consists of brain and spinal cord and the individual nerves that go throughout the body. The skin protects your body from the environment and regulates internal temperature of the body and transmits sensations from the skin to the nervous system. And then remember, your vital signs change at different points during your life or your life cycle. So we have a couple of review questions we'll go over here. Which of the following patients is in the anatomic position? Is it A, a man lying down on his back with his arms across his chest? B, a woman standing facing you with arms at the sides and thumbs pointed outward? C, a child on her left side with her right knee pulled up toward her stomach? Or is it D, a man facing you with his feet 12 inches apart and his hands interlocked behind his head, like so? The answer for that one is going to be B, a woman standing facing you with her arms at her sides and her thumbs pointing outwards. Question 2, when referring to the human body, the term proximal means, is it A, closest to the point where an arm or leg is attached; B, a position that is closer to the feet; or C, a position on the back of the body; or D, connected to the pelvis? The correct answer is A, the closest point to where an arm or a leg is attached. So the proximal end of your humerus is going to be up here by your shoulder. And question 3, the respiratory system is responsible for, is it A, transporting oxygenated blood through the body; B, ensuring that the body has an adequate supply of red blood cells; C, removing carbon monoxide from the body; or D, providing oxygen for the body and removing carbon dioxide? The answer is D, providing oxygen for the body and removing carbon dioxide. Okay, so that's what we have for the human body. Go ahead and review your chapter 6. It has a lot more detailed information. And if you have any questions, feel free to email or put it in the chat for the class chat. And next we'll pick up chapter 7.